Cervical dysplasia, how to navigate health care. Cervical dysplasia is a condition that can sound alarming, but understanding it can empower you in your healthcare journey. It involves abnormal cell growth on the cervix, often found during routine screenings like pap smears. Knowing how to navigate healthcare for cervical dysplasia is crucial, as it involves understanding your diagnosis, follow-up tests, treatment options, and the importance of personalized care. Cervical dysplasia is classified into grades known as cervical intraepithelial neoplasia, or CIN. CIN 1 indicates mild dysplasia, which often resolves on its own without treatment. CIN 2 and CIN 3 are moderate to severe dysplasia, which carry a higher risk of progressing to cervical cancer if not addressed. Detection usually starts with a pap smear, where cervical cells are collected and examined. If abnormal cells are found, your healthcare provider may recommend further evaluation with human papillomavirus testing and colposcopy, a detailed examination of the cervix that may include a biopsy. For those diagnosed with low-grade dysplasia, such as CIN 1, healthcare providers often recommend monitoring through repeat pap smears and HPV testing at regular intervals. Many cases of CIN 1 regress naturally, so close observation is key. However, for higher grades like CIN 2 or CIN 3, more active intervention is typically advised due to the increased risk of progression to cancer. Treatment options vary based on the severity of dysplasia, your age, reproductive plans, and overall health. Common treatments aim to remove or destroy abnormal cells. Ablative procedures, such as cryotherapy, freeze the cells, while excisional procedures like loop electrosurgical excision procedure or cold knife conization remove affected tissue. These treatments have a high success rate, around 90%, in curing cervical dysplasia, but they may carry risks, especially regarding future pregnancies. It is essential to discuss your fertility desires and any potential risks with your healthcare provider. Special considerations come into play for certain groups. If you are pregnant, treatment may be deferred or modified to protect the fetus, with close monitoring instead. For individuals who are HIV positive or immunocompromised, more frequent screenings and closer follow-up may be necessary due to a higher risk of progression. Navigating healthcare for cervical dysplasia requires collaboration with healthcare professionals who can interpret your test results and explain the risks and benefits of treatment options. Self-management or alternative therapies should not replace evidence-based medical care. While cervical dysplasia is a precursor to cervical cancer, it is distinct from testicular cancer, but both fall under the broader category of reproductive cancers. Awareness and early intervention in cervical dysplasia are vital for preventing progression to invasive cervical cancer, aligning with the goals of reproductive cancer prevention. In summary, managing cervical dysplasia involves timely screening, accurate diagnosis, risk-based follow-up, and appropriate treatment guided by healthcare professionals. Open communication with your providers about your reproductive goals and health status will help ensure the best outcomes while minimizing risks. Always remember to consult with your healthcare provider for personalized medical advice tailored to your unique situation.